to meet the goal they set 2 years ago at the United Nations General Assembly, the goal to scale up towards the prevention, universal access to HIV prevention, treatment, care, and support by 2010. As a result, they will have a great difficulty in reaching the Millennium Development Goals of halting and reversing the spread of AIDS by 2015. This will have repercussions on many fronts. For halting and reversing the spread of AIDS, it's not only a Millennium Development Goal in itself. How we fare in fighting AIDS will impact all our efforts to cut poverty and improve nutrition, reduce child mortality, and improve maternal health, curb the spread of malaria and tuberculosis, and strengthen health systems. Conversely, progress towards the other goals is critical to progress on AIDS, from education to the empowerment of women and girls. Excellencies, ladies and gentlemen, as the fight against AIDS nears the end of its third decade, we are still facing a huge shortfall in resources. The responses to HIV and AIDS require long-term and sustained financing. As more people go to treatment and live longer, budgets will have to increase considerably over the next few decades. In the most affected countries, donors will have to provide majority of the funding. I warmly congratulate the United States government on the new legislation that will allow for $48 billion to be spent on the fight against AIDS, tuberculosis, and malaria over the next 5 years. I also welcome the commitment of the G8 to keep working towards the goal of universal access to HIV prevention and treatment by 2010. Just as important, in most countries, a stigma against people living with HIV remains a grave challenge. 1/3 of countries still do not have laws to protect people living with HIV. In most countries, discrimination remains legal against women, men who have sex with men, sex workers, drug users, and ethnic minorities. This must change. I call on all countries to live up to their commitments to enact or enforce legislation outlawing discrimination against people living with HIV and members of vulnerable groups. I call on them to follow Mexico's bold example and pass laws against homophobia. Since taking up the position of Secretary General of the United Nations, some of my most moving and inspiring experiences have been meeting with colleagues and others living with HIV. They are wonderfully courageous and motivated people and should serve as an example to us all on how to act